Often our first contact with the health system is when we become ill, but clinical care is just one component. Optimal health requires a two-pronged approach including disease prevention and intervention. In order for these to be effective, they should also be affordable and accessible so they reach the people who need them the most. Health systems operate in numerous different settings and are supported by a variety of legislative, regulatory and funding arrangements. Commonly, these settings include community health and public health systems. Public health involves primary prevention for those who are well and secondary prevention for people at risk. Community health includes intervention for early stages of disease and chronic disease management for those with complex advanced conditions. Community health is concerned with the health of specific communities and tends to focus on geographical areas. Health promotion plays a role in community health, however the focus tends to be on intervention, including primary, secondary and tertiary healthcare. Community organisations provide local residents with access to health services from a central location, offering interventions that are tailored to that particular community's needs. These services can include nutrition and dietetics, chronic disease management, disability and mental health services. The aim is affordable healthcare, with some services free, others charged according to the client's ability to pay, for example, discounted for pension holders. Public health is the efforts of the community organised by society to protect, promote and restore people's health. They undertake preventative programs geared towards everyone in the population. The aim is to maintain and improve the health of all people through collective or social actions, particularly in the areas of disease prevention and policy development. In Australia, public health is core focus for health authorities in an effort to prevent disease through advocacy and public action by incorporating interdisciplinary areas including epidemiology, biostatistics and public policy. The following elements are vital to a successful public health organisation: research and programs, regulation and policy, and monitoring and evaluation. The support of research and innovations that address inequalities, undertaking effective activities and interventions that aim to improve promotional health, including data collection, dissemination and analysis, relevant clinical tools, and decision-making support. Leadership in policy development in the areas of health protection, promotion and preventative healthcare to facilitate organisational partnerships, collaboration with outside services, workforce development, improving access to staff by education training and quality assurance programs. Development and implement structured monitoring and evaluation strategies to support a sustainable and effective public health system, guiding finance and resource allocation, communications, introducing community awareness, information systems. These key elements play a major role in supporting social determinant approach to healthy eating. Identify the influences on a population health food choices, including economic, social and environmental factors, utilising this information to design appropriate programs that increase the food and nutrition knowledge of the population and empower them to make good choices. The availability, quality, price and food may be determined by food production policy, food and nutrition regulation, trade agreements, food taxes and transport policy. Providing guidance for service planning of sustainable food and nutrition systems. To investigate this further, we will look at a public health organisation in detail, the Goldfields Public Health Unit in regional Western Australia. They provide a number of public health services and include health promotion and nutrition teams who work closely together to coordinate the program. Due to the remote location and unique demographics, the Goldfield region has a very diverse population. The culturally diverse nature of the population requires Goldfields to service different groups with varying priorities. High school students, mental health nutrition, child and infant nutrition, food for first years, elderly communities, nutrition for older years, and rehab, nutrition with drug and alcohol abuse. For each group, adaptations in language, verbal and non-verbal, content, what messages to focus on, delivery method, when, where and how, and resources are needed to produce the most effective and appropriate program possible. The most important element of being a culturally competent practitioner is the ability to feel comfortable with many different groups of people. This can put consumers at ease, make them feel supported, respected and comfortable accessing programs. If consumers feel supported, welcome and comfortable, they're more likely to access health services.
created using Powtoon.